A pleasant day to everyone. I am Monette Varona and I will be your host for today. We would like to thank you for attending this online learning session on the National Vaccination Plan and Covovax, organized by the Philippine Business for Social Progress. Since March of last year, PBSP has been a staunch advocate of our fight against COVID 19. Today, this learning session will discuss the National Deployment and Vaccination Plan and how it will be implemented by the national government, local government units, and partners in the private sector and development community. This session will also provide updates on the status of the Covovax. To formally open this event, allow me to call on the President and CEO of PBSP, Mr. Reynaldo Antonio D. Laguna, to give us his welcome remarks.
Hello, good morning, everyone. The global COVID-19 pandemic is far from over. The total cases have breached worldwide to 100 million and with nearly 2.5 million deaths. For the Philippines, we have 564,865 cases and more than 12,000 deaths. Our curve has not exactly flattened, although it has plateaued with parts of NCR, Central Visayas, Calabar Zone, and Central Luzon as persistent or emerging hotspots. We have tested more than 8.1 million Filipinos since the start of the pandemic, with about 20 to 40,000 tests daily these past weeks, and a cumulative test positivity rate of 7.8%. The nationwide ICU bed occupancy is at 39.9%. The targets for these last two figures are 5% and 30% respectively to say that we are effectively containing the virus. The resulting economic and social pains, particularly for those at the margins of our society, have been significant. The economic recession of 2020 is the worst since the Second World War. Agriculture, industry, and services sectors all contracted, with 4.5 million Filipinos becoming jobless. Estimated decline in the economic output vis-a-vis the previous year is at 1.5 trillion pesos. This contraction is disproportionately shouldered by the poor and underserved, with rising inequity. These public health and economic crises have led to other crises as well, on education, learning, and workforce development, on mental health, on violence against women and children, and on the overall ability of communities to be self-reliant and to participate purposively in civic affairs. This pandemic has been a boon to the ultra-rich and elite, however, but it has also led to unprecedented and historic levels of wealth concentration. Vaccines are on the way, and our country needs all hands on deck across public and private sectors to achieve herd immunity. It is remarkable that we have multiple viable vaccines globally this soon. This is a triumph of science, but also of public policy and private sector leadership. Vaccines are here as a result of worldwide collaboration that is always essential but rarely reached in human history. In the Philippines, our target is to vaccinate 70 million adult Filipinos this year, with national and local governments, along with the private sector, securing anywhere from 148 to 192 million doses. The government has released the National Deployment and Vaccination Plan for COVID-19 vaccines, or NDVP, last month. It outlines the how, while the who are mainly the local government units and the public health sector. There are 3 points that we would like you to take note as we listen to our esteemed speakers. Number one, we must always seek to uphold truth, integrity, and transparency in information. Information that is critical in decision-making and planning for the future. If we are to engage the general public, we still need to communicate risks properly and adopt the right tools in promoting health-seeking behavior. Number two, we believe that partnerships and a multi-sectoral approach is the only way to go in finding the right solutions and implementing the right interventions, in a right and timely manner. We would like to thank Dr. Beverly Ho of the Department of Health and Dr. Nancy Bermal of RightMed for lending us their time and expertise. Third, we thank all of those who are attending this session because we all have a role in getting the right information and sharing these with our own respective networks. There must be a conscious effort to reach out more to those who are not online and allow them to discern and make the right health decisions for themselves and their families. We must strongly advocate for equity, not just in access to vaccines, but even access to the right information. The problems we face are too big for any one group to solve, and we are called yet again to demonstrate the Bayanihan spirit and work together. Beyond this session, PBSP and its member companies will capitalize on its strengths to complement the different efforts being undertaken by various groups and organizations. Our call to action, magbayanihan tayo para sa bakuna, with national and local governments mobilizing its immense but still limited resources. The private and non-government sectors have stepped up and will continue to do so in the rollout of vaccines. These efforts are neither new nor unexpected. Our sectors have done their best to respond to the pandemic and recession these past 11 months. It has not been easy for all of us, but we all understand what is at stake, and we do what we can for the people and communities we serve. Hashtag Bayanihan sa Bakuna, beyond the handle for this and subsequent learning sessions is our call to action. Let's reduce the gap between those who have critical information and those who require the information. Let us also assist local governments actually implement the national vaccination plan. Philippine Business for Social Progress, our members and partners, and the broader private and development sectors will continue to engage and support government at the national and local levels as we navigate and ultimately move past this pandemic. Finally, I'd like to thank also Radius Telecommunications for helping boost our internet connectivity to provide more access and for people to attend this learning session. Thank you very much and good morning to all.
Thank you, Mr. Laguda. Now, to introduce our keynote speaker, may I call on Mr. Elvin Ivan Uy, Executive Director of PBSP.
Maraming salamat, Monet. Maraming salamat, Ray. Magandang umaga sa ating lahat. This is a good morning because we have come together to discuss something of national and global import. The COVID-19 vaccines that should be underway for our country and the rest of the world will have immense impact on our way of life and on the way we would recover and hopefully build back better sooner rather than later. We have two resource persons this morning. We will do the first half of this session with the Department of Health, and then we will have the second half will be focused on a particular vaccine with RightMed Group. For our first part to discuss the National Deployment and Vaccination Plan for COVID-19 Vaccines, or NDVP. She has been with the Department of Health for several years. You will be familiar with her. She has been one of the public faces ng kagawaran ng kalusugan. She is currently the director for both the Health Promotion Bureau and the Disease Prevention and Control Bureau. I promise not to embarrass her in my introduction, so I'll keep it at that. But she's also a longtime friend. Friends, partners, fellow Filipinos, let us all welcome Dr. Beverly Lorraine Ho. Doc Bev, magandang umaga.
Good morning, everyone. Good morning, Elvin. Thank you for the introduction. Maraming salamat po ulit sa PBSP for this opportunity to use your platform to reach more people in facilitating the understanding of our COVID-19 vaccine rollout in the country. So sabi nga po ni Sir Ray kanina, mahalaga po na lahat tayo ay nagtutulong-tulong because this is actually the first time or perhaps the only time that our country will be rolling out such a big public health program. And it is going to be unprecedented, no? Hindi po kakayanin na gobyerno lang po talaga yung kikilo. So, talents from all sectors, for-profit, non-profit, will all need to be tapped in order for us to successfully mount this vaccination program. So, I'll go through the presentation po. Hopefully to facilitate understanding, we cut it into 10 main questions. And para hindi rin po tayo mawala, no? And each of the questions will tackle most of the issues and also the key concepts that we hope everyone will imbibe or will try to understand as we collectively do our part in this Vida Vaccination effort. So maraming salamat po ulit to a few people whose slides we have borrowed for this presentation also. And then I also declare no conflict of interest. All of the brands that will be mentioned are for presentation purposes po, and we have no relationship with them. So before I begin, I think we just need to review a little bit about where or who COVID-19, the COVID-19 virus affects. No? So for cases, it's very clear to us that the data shows that it's with people 20 to 39 years old, relatively young. And then deaths or the serious cases of COVID-19 usually happens among more than 60 years old. This is going to be very important po mamaya kapag titingnan natin paano po tayo nag-prioritize ng ating programa. Second, more important is that pag sinabi pong na COVID tayo, hindi po siya pare-pareho, no? So there's such a thing as mild, moderate, and severe COVID infection. Had it been that COVID infection will always just be mild, siguro chillax lang po tayong lahat, di ba? Pero sa totoo lang, hindi kasi, no? So meron pong COVID infections na nag-progress into severe, no? And dito kapag severe COVID infection, that's the one where around 5 to 10% of the patients can die. This is where visually, nasa ICU po tayo, no? Pero kapag moderate, you're in the hospital but you're likely on oxygen support only. And less than 1% can actually die from moderate COVID. So kung titingnan natin, it's actually the severe COVID that we are almost afraid of. And this should also guide us in thinking about sino ba dapat ang makakuha at ano ba talaga yung objectives natin sa programang ito. So I'll now begin with several of the questions that we often get from everyone. No? So una, why do we need to get vaccinated? Perhaps Doc Nancy will expound on this a little bit more, but there are just two main concepts that we want everyone to understand. That vaccination actually helps us protect ourselves and our families, but it also helps protect the vulnerable, particularly those who will really not be able to get the vaccine, no? Kasi mamaya malalaman niyo din po na meron talagang mga tao na hindi po sila maging eligible to get the vaccine. So first of all, kunwari in protecting ourselves, we also want everyone to remember that there are three endpoints that we are talking about. And when we talk about endpoints, ibig sabihin ito po yung epekto ng bakuna, no? So first, we go to this picture. Ano ba yung pagbabakuna? No, it's simply like a practice, no, for your body. Pwede naman tayong, kunwari, nung bata tayo, itapon tayo sa tubig, di ba? Sabi nga, kaya naman natin lumangoy. But there's a small chance, chance that you actually might drown, di ba, as a kid. So, kids are brought into swimming lessons, so to speak, or hahawakan sila ng mommy nila, or nakasalbabida sila, di ba? Another way of looking at it is your body needs to know who the enemy is. And COVID is a thief in the night, right? So kung kailangan ng body mo malaman kung sino yung masamang tao, para siyang kailangan mo ng wanted na poster, di ba? When you actually see on the poster who the perpetrator is, pag na-meet mo siya, alam mong lalayo ka sa kanya. No? So that's exactly what you want to get from vaccination. So when you get vaccinated, there's an acquired immunity that you want to have. But then this immunity can be caused by natural infection, so talagang nagkasakit ka, or nabakunahan ka. No? So in both cases, you will see yung naka-color red, yun yung parang substance that triggers that immune response. So in case of a natural infection, siya po yung antigen, di ba? Kaya nga meron tayong antigen test, no? Tinitingnan kung nandun si SARS-CoV-2 sa'yo. Yung kapatid naman niya or pinsan niya is the immunogen. Yun naman yung pinapasok sa katawan mo through a COVID-19 vaccine. Diba? So it's a similar form to the antigen pero hindi mo kailangan magkasakit because it's packaged through that COVID-19 vaccine. So in both cases, they should lead to acquired immunity for all of us. And kung mas marami na sa atin yung meron, herd immunity for the population. So we go back to the first concept, which is to protect ourselves, di ba? We need to remember the 3 endpoints. Oftentimes, importante to, kasi yung napapublish laging percentage is yung percentage related to number 1, yung preventing symptomatic infection. Kumbaga, sinasabi nito that the vaccines have the ability to make your COVID infection parang asymptomatic, no? So, dito sa picture na to, care of Doc Edsel, he described COVID-19, the virus, the SARS-CoV-2 virus, as like a lion, no? May bangis, no, ng lion na to. Pero yung bangis na yon, parang nilagay mo siya sa hawla or sa cage, di ba? Ibig sabihin, hindi na namamanifest yung bangis, no? And that's the first endpoint or first effect of COVID-19 vaccine. The second endpoint is when COVID-19 vaccines can prevent severe infection. So yung lion, ginawa mo siyang kitten, no? Ginawa mo siyang kuting. Parang hindi ka na niya kayang kagatin, di ba? Kaya ka na lang niyang kalmutin. So that's making sure that you don't go into ICU level, no? Yung severe infection. Pwede ka magkaroon, sipon-sipon, or even mild to moderate, di ba? And the last part is actually really preventing transmission. So this one is admittedly the one na kailangan pa natin ng more info, no? So may early indications from studies that this is actually possible, pero mahirap po siya gawin sa actual na trial, no? Kasi ibig sabihin linggo-linggo kailangan mong i-RT-PCR yung mga tao na kasama sa trial to make sure na hindi sila nagkaroon. Yung number 1, make sure yung prevent symptomatic infection, titingnan mo lang sila, nako, sinipon na ba sila, nag-anosmia na ba sila? Yung pangalawa, okay, nagka-symptom sila pero hindi mo sila kailangan dalhin sa ICU, di ba? Yung pangatlo, medyo mahirap, no? Kaya patuloy pa rin yung mga pag-aaral related to preventing transmission. But in terms of preventing symptomatic infection and severe infection, the evidence is actually pretty clear already. So what we hope you will take away from this lecture is that you will always look for 2 numbers, no, when it gets reported. How well is this vaccine in preventing symptomatic infection, and how well is this vaccine in preventing severe infection? No, apart from preventing transmission. Yung third, medyo mahirap pa natin mahanap sa literature. As we talked about immunity kanina, we tackled herd immunity. I guess the question for many people is, kailangan ba talaga natin magpabakuna, no, para magka-immunity? Okay lang naman, magiging immune din pala ako kung nagkaroon ako ng infection. So the 3 boxes above shows the progression of a naive population or sinasabing mga population na hindi pa naapektuhan, no? So we're basically blue people, di ba? Yun yung color blue. And then if someone is red, so someone who's infected gets into contact with us, then we also become red, no? And eventually after becoming red, then we become yellow or recovered or immune, diba? But then this process has risk, diba? Because you're parang putting yourself at risk for possibly severe COVID-19 infection. On the contrary, dun sa baba po, what we're targeting is that we get vaccinated so that easily we all become yellows. no? And the red couldn't transform us to become red or infectious, di ba? That puts our risk of severe infection or death actually much lower to zero. But more importantly, if you look at the last box on the lower right-hand side, what you want to happen here is that there are some people who will always be color blue, right? Because they can't get the vaccines. Later on, malalaman natin sino sila, no? They will always be blue, but because we're all yellow already, then we are protecting them. No? So, yun din po yung sanang maisip natin, bakit natin kailangan gawin ito. Okay, so there are many immunogens. So immunogens yung mga pinabait, no, na antigen to develop various viral vaccines. I won't go through this table in greater detail since we're going to be sharing the presentation with all of you. But suffice to say that if you look at the left-hand side, the leftmost column, you have various forms of immunogen. So attenuated, whole inactivated virus, a protein subunit, etc. No? And then on the right-hand side, you will see the different types of vaccines that have been used in the past more than 40, 50 years already. And they pertain to those kinds of immunogen. So, syempre lahat, no? Lahat ng bagay may plus, may minus, no? Depende siya kung paano natin siya gagamitin. And I'd just like to show you here, at least for the COVID-19 vaccines, meron po silang iba-ibang klase. Mahirap intindihin siguro yung mga pictures, no? Pero dun sa mga binilugan ko po, meron kayong makikita na common, no? So nakalagay po doon, merong parang amoeba figure, di ba? Tapos meron po siyang mga pula-pula na nakakabit doon sa parang tentacles niya or kamay niya. No? So this amoeba figure is what we call an antigen presenting cell. No? So siya po yung parang kamay na naghahawak po ng wanted na sign. No? So yung wanted na sign, ang picture na nandun is ito pong si coronavirus spike peptide. No? Itong pula-pula pong nakikita nyo na naka-attach. So ang goal po ng lahat ng bakuna is kailangan po si antigen presenting cell, hawak-hawak niya itong picture, no? Itong wanted sign na coronavirus spike peptide. Parang sinasabi niya, nandito na siya, nandito na yung masamang tao, so mag-immune response na tayo. So kung makikita nyo, lahat sila, iba-iba po ng mechanism sa umpisa. Merong iba, parang diretso nating binigay yung spike peptide, yun yung protein-based. Meron pong iba, pinasok pa natin sa sobre. Yung iba, parang pinadaan natin sa Xerox machine, yung RNA. Pero lahat sila, yung endpoint ay immune response. You might also want to think of it as there are many ways for us to send an SMS message, right? Pwede tayong gumamit ng Viber, ng WhatsApp, gamitin natin yung desktop computer natin. Pero at the end of the day, ang kailangan natin is ma-send yung message across. And that message across is this picture, no? Is this wanted picture of the coronavirus spike peptide. Now, which vaccines will we actually use? There are 7 vaccines that we are in negotiation with as a country, and that's because of 2 things. 80% of global vaccine supplies have already been accounted for by high-income countries. Second, our huge population, it lends us to not having a single manufacturer being able to provide us with all the vaccines stocks that we need. No? So we have to do away with a portfolio. Kumbaga, maraming suppliers tayo kasi mas malaki yung kailangan natin. But it is important to take note that while we negotiate with most of them, it won't really proceed until they do get the nod of the Food and Drug Administration via an EUA. So as of today, there are 3 EUAs that have been granted, and out of all of the 7 here, only the Janssen one is 1 dose. No? So everything else is 2 doses. So here is just a summary of when they applied in the Philippine FDA and also which countries they have an EUA with. So you will also see here, importante, no, that our Philippine FDA also benchmarks itself with what they call stringent regulatory authorities. Some of the vaccines that you see are provided for an EUA in countries but not necessarily having stringent regulatory authorities, di ba? So dito naman, we tried to summarize, no, the 7 vaccines, the doses, di ba, kung kailan mo siya ite-take, the temperature at which they need to be in. I think I have to apply, just edit the EUA for Sinovac because they have also been granted na. And then contraindications, no? So contraindications are the hard no's, no, for the vaccine. So kung makikita niyo po dito, Moderna and Pfizer as mRNA vaccine, they're contraindicated for those with history of severe allergic reaction. Other than that, there's really no clear contraindications mentioned for all the other vaccines. And then, important also to note that at least for Pfizer, Moderna, and to a certain extent, AstraZeneca, they're the ones who need colder temperature. Lahat, most of the vaccines are okay for 2 to 8 degrees Celsius. And the 2 to 8 degrees Celsius po is the regular cold chain that we have. Ibig sabihin, when you visit your pediatrician, di ba, naka-ref po yung vaccines ng baby nyo. So, yun po, yung regular natin, 2 to 8 degrees Celsius, parang ref po, di ba? But for these different types of vaccines, medyo malamig yung kailangan nila, significantly colder than the typical. And if we put them in 2 to 8 degrees Celsius, their shelf life becomes shorter. No? So, ito rin po later yung magdidictate which products can only be shipped to certain areas. So, for example, if a company opts to buy a certain brand here, but it requires super cold temperature, then the company will really have to think twice, no, when they work with the local government unit because some of their staff who might be in their regional offices might actually not be able to get this. Bakit? Kung wala pong shipping, like the cold chain shipping services for those areas, then mahirap po makuha siya, di ba? So tayo naman sa government, for example, if Pfizer arrives, it's clear to the operations group that the Pfizer vaccines, because they need a certain level of temperature, we wouldn't aim to bring Pfizer vaccines to, say, a far-flung area because the cold chain in the far-flung area are only 2 to 8 degrees, for example. So this is how it's gonna impact the planning. No? So hindi siya one size fits all. There are many expert groups who help us decide, and each expert group has particular questions that they actually need to answer. So we begin with the DOST vaccine expert panel, for example, who decide on which vaccines can undertake clinical trials in the country and which vaccines should we start negotiating with. So they actually are the ones who decided on the portfolio, no, the 7. Then the Philippine FDA now decides on the question whether the vaccine is safe, efficacious, and do benefits outweigh the risk. Then the Health Technology Assessment Council under the UHC law is supposed to decide on whether we should actually buy a certain vaccine. No? So hindi included yung, so kunwari pag donated, no, etc. Hindi siya usually kasama. So ito, if the DOH or PhilHealth should buy a certain health technology, not specifically vaccine. Then the National Immunization Technical Advisory Group is more about how to operationalize the entire process. So how should it be delivered to the people? Kaya sila din po yung nag-decide or nag-recommend on priority groups. And then finally, the National Adverse Events Following Immunization Committee, or NAFIC, who is in charge of making sure or investigating whether certain reported adverse events are caused by the vaccines. No? So you will see that these are all independent expert groups, meaning they are free to say, no, what really needs to be said, because we know that the process needs to be science-led and expert-based. All right, so just going very quickly by the vaccine development and approval, we know that all drugs and vaccines, health technologies would really typically go through the following phases. May preclinical trial, phase 1 trial, phase 2 trial, phase 3. Dati po, kung normal times, hindi po pandemya, we usually wait for the product to finish phase 3. No? Dapat tapos na po yung phase 3 bago po sila mag-a-apply ng permiso sa ating FDA. But in the context of the pandemic, we had to shorten this, no? Ibig sabihin, they're still not yet done with phase 3, but because there are already reports that it is safe and efficacious, they have been assessed to be safe and efficacious, and the benefits outweigh the risk of administering them, then they are actually going to get a special permit called emergency use authorization. So parang paano ba to, no? So you might ask, nakakatakot ba? It's similar to say you going out of your house and crossing the street to buy something or going to work, 'di ba? All of it may risk naman po na kasama, no? May risk ka na masagasaan, may risk ka na ma-hold up, may risk ka na madapa, but we still continue to do the task that we need to do because the benefits of going to the office, the benefits of eating your favorite food sa kanto is actually going to outweigh the risk, di ba? So, ganun siya. Then, the next part here is, sino yung mananagot, no? Simply say it, sino yung may responsibility ngayon if may mangyari. So under an emergency use authorization, because it's like the government saying, we want to use your product kahit hindi ka pa tapos, then it's the government that's parang taking on the responsibility. As opposed to a certificate of product registration, baliktad, no? It's the company that's telling the government, please give me a permit. So the government says, okay, if we use your product and if may mangyari, kayo yung mananagot. But for EUA, for which we're giving to all of the manufacturers now for vaccine, government po yung parang sole responsible, no, kung may mangyari. And this is also why the private sector groups are entering into a tripartite agreement, no. Hindi po ito dahil government doesn't want private sector or LGUs to buy directly. It's really because the companies don't want to deal with it's really because the countries don't want to deal with the companies don't want to deal directly with the individual companies, no, or the individual LGUs. Mahalaga po to, no, kasi hindi po siya dahil gusto lang natin na isa lang ang nag-negotiate. Mas mahalaga po dito, it's really the manufacturers want someone to be responsible, di ba? And that someone is the national government. At mahihirapan yung any private entity or any local government unit to assume that responsibility. Okay, so when you ask, can a person choose the brand of vaccine that will be given to him or her? If it's based on the national government rollout, no po, no? So when you are scheduled, then whatever vaccines that arrive in that area, granted na hindi po kayo contraindicated doon, you will only have access to that vaccine. However, if you want to decline the vaccination, you can actually opt to do so. So I think for private sector groups that bought vaccines, I don't think you're buying a whole range din po, no? So most of you are buying one brand only. So I guess it also applies to your employees. So anyone can decline the vaccination, but if he or she suddenly says, ay gusto ko pala, no? So pwede pa rin naman siya. Pero kailangan matapos na yung buong cohort bago po siya ulit pwedeng mapasok. Then, will a person receive the same brand? Yes, we're making sure of this. So example, if 100,000 lang yung dadating na bakuna, the planning is such that only 50,000 people will actually be registered, no, for that round. Para sigurado tayo that within 21 or 28 days, mabakunahan na sila ng second dose nila. So do we have to pay for anything? So the general policy direction for this is the vaccines have to be 100% free. They're provided partly by Gavi, or the Global Alliance for Vaccine Initiative, funded by government loans from World Bank and ADB. And finally, through tripartite agreements wherein the private sector have agreed to provide to their employees for free and donate 50% to the government. And LGUs obviously have to also provide it to their constituents for free. So what are the goals of that's why we're prioritizing certain groups, no, in the vaccination. So I guess we need to just focus on the primary goal, which is to maintain critical essential services, particularly health services, and direct reduction of morbidity and mortality. So balik tayo dun sa first two slides that I showed you, di ba? So it's important that we make sure the healthcare system does not collapse, no? Kasi lahat tayo pwede magkasakit, tas hindi man pwedeng walang healthcare system kasi lahat sila nagkasakit. Next is to directly reduce mortality and morbidity. Ito yung mga severe COVID infections and deaths, no? Kasi sila actually yung tinitingnan natin na minention ni Sir Ray kanina, di ba? Yung critical care utilization rate ng ating mga hospital. So ito talaga yung primary goal. So in view of that, who are the people that we actually need to cover, no, in order to get to this goal? So we modified through our NITAG this WHO SAGE guidelines, which talks about frontline health workers being the first in line to actually get the vaccination. So then followed by senior citizens and people with comorbidities, followed by frontline personnel in essential sector, including uniformed personnel and the indigent population. So indigent population is largely more because they live in crowded areas and transmission is significantly going to be higher in those areas. I won't go through greater detail of priority eligible group B and group C, all remaining Filipinos already. We'll share the slides with all of you. But when people also ask, like within those priority groups, do we still prioritize further? No? Syempre, because the vaccines all don't arrive at the same time. So if we have around 2 million frontline healthcare workers, hindi naman po 2 million or 4 million doses yung dadating kaagad, di ba? So we also prioritize further. So then the second and third criterion will be actually the need, no, of the area. So we always say if it's a nurse in Manila, which has higher number of cases versus a nurse in Batanes, then mauna po yung nurse in Manila, no? Second, may doktor na nag-rounds pa rin siya every day sa hospital versus a doctor who does telemedicine consultation. So mauna po yung doctor with higher exposure, di ba? So that's how we sub-prioritize. And that's why in the initial recommendations of the NITAG, it's the COVID referral hospitals that are going to go first, di ba? Before, say, health workers in outpatient clinics, for example. So question number 5, when and where will I get vaccinated? So the answer to this depends on your priority group and when the vaccines are arriving. So the second part is really the critical, most critical part, because we're also seeing that even in Europe, where they've placed their orders far earlier than we did, nahirapan din po sila to get their supplies, right? And more importantly, that the LGU is the main implementation body and that we coordinate everything with them. So for those of you who are not typically working with the health sector, we are in a devolved setup, and that means that the DOH only has control until the regional levels. And all the operational work of service provision is actually not being done by the DOH, but by local government units, and over the last 30 years, a lot of private sector providers. So how will this all go? No? So the main implementing body will be local government units, as what we have done for COVID-19. Diba? Lahat po, kung magkaka-symptom ka, magkakakaso ka, you report to your barangay health emergency response team, and then it gets recorded in the provincial, city, or municipal health office. It's exactly going to be like that, no? Dahil, bakit ito important? Because this won't be a one-time thing, no? Hindi to parang kumuha ka ng regalo, no, sa health center mo or kumuha ka ng regalo from your city hall. After the vaccine, yes, kukuha ka ng regalo, pero mamamonitor ka for a whole 1 year. And who will monitor you? It's actually the local epidemiological surveillance unit, no, in your city, municipality, or province. And that's why it's important that even if the private sector has bought vaccines, they really need to work with the local government units. So practically, ano po ibig sabihin nito? If I'm a big company, bumili ako ng bakuna, I have 10 branches all over the country in 10 cities, then I will coordinate these my employees coming from the 10 cities kung doon sila babakunahan with the 10 LGUs, no? So importante 'yon. Unless all of them will be vaccinated only in one LGU. In any case, what we have been assured of by the DICT is that the info system for all of the vaccine providers will be similar, no? So the front end might be different, but at the back end, it's all going to be unified. So you'll see here on the right-hand side, for actual implementation, what has been decided already is that once the national supply comes in now in the first quarter, we provide vaccines for all frontline workers in health and senior citizens. No? And this will be distributed to the entire country na. No? So dapat matapos natin yung health workers at senior citizens mula Apari hanggang Holo. Di ba? Pagtapos na po yun, we now go into parallel system na, no? So magba-branch na. So yung mga nabili ng national government, nabili ng LGU, tsaka ng private, sabay-sabay na tayo magbabakuna. Pero syempre, we're all still following the same prioritization criteria. No? So this is really the goalpost, no, for now. Then many of you are also asking, am I going to be vaccinated? So you will really have to wait for the LGUs to announce this. No? Bakit? The DOH is working with the LGUs, our regional offices, to identify which are the vaccination sites. These could be hospitals, medical centers, public and private, no? Rural health unit, health facilities, or private clinics. But the idea here lang talaga is they have to be fixed post, no? Hindi po talaga tayo at all magka-house to house campaign. Not only that it's going to be taxing, no? Kasi but more importantly, kailangan po kasi ma-monitor for 1 hour yung patient after vaccination. So if we go house to house, then a whole team of people will actually need to wait in the house of the person for an hour to observe bago sila makaproceed to the next, no? Hindi natin talaga yun kaya. So we need everyone to go to the post. Now, I know PBSP works with also some of the geographically isolated and disadvantaged areas, di ba? Mga far-flung areas. Then the challenge there would be for us to have a mechanism to ferry the people into the vaccination post. Unless we are able to set up sort of like a clinic there and be able to observe them for an hour. So in any case, kung GIDA kasi, talagang kahit mag-fix post ka doon in their area, you will need to help ferry people into that fixed post. No? So, hindi po tayo house to house. Then overall, what should we expect, no, the vaccination pathway to be? We register, we get pre-vaccination counseling from our either a rural health physician, the health center, or yung private clinics that are going to be contracted, screening, vaccination on the actual day, and post-vaccination monitoring and surveillance. So doon po sa first box, registration, depende po ito, no? So some of the private entities also already have the registration process. Most of the LGUs, may mga records na rin sila ng mga senior citizens, kunwari, no? So medyo nagtataka yung iba, bakit hindi kami nire-register? May ongoing ngayon sa mga hospitals for healthcare workers. Again, all of these converge in the single database of the ICT, no? So that a person, even if very eager, nag-register siya sa tatlong cities, mamimake sure, no, na talagang yung allocation niya isa lang po. Then, I think it's important to note here in the post-vaccination monitoring that we observe the patient for the first 30 minutes to an hour. And the main reason for doing this is really because most of the effects happen during this period, no? And when we're able to observe that patient at naka-fix post tayo, merong way for us to bring the patients to the hospital. Kung nasa hospital yung fixed post, nandun na, or kasama po kasi sa protocol is may kasamang ambulance yung other post. No? So madadala siya kaagad. So all of these are taken into account when DOH and the LGU plans the setup in the area. So then, this is still not yet officially released. So the health assessment algorithm basically dictates who should not be vaccinated, are there special precautions, etc. So dito alam natin, no, because most of the studies are still not yet applicable to age 16 years old and below, to children, then we don't include them in the vaccination. Then the only other contraindication, as I mentioned to you, are allergy to PEG or polysorbate and severe allergic reaction after the first dose of the vaccine. So hindi po to yung parang kapag kumain ako nangangati ako, no. That's not severe allergic reaction. It's really allergic reaction wherein you cannot you cannot breathe, there's really like feeling of impending doom, etc. No? So hindi siya yung parang konting kate, okay na, hindi na ako magpapabakuna. Ideally, you do have to get screened by your physician to know whether what you're experiencing is actually a strong contraindication against receiving the vaccine. Next, if you have allergy to some food, egg, or medicine, there's really just special precaution. You will still need to be vaccinated, but you will be observed more. Then, if you have history of bleeding disorders or currently taking anticoagulants, yes, you will still need to get your vaccine, but you need to use smaller gauge na needle kasi mas mabilis kang madugo, no? So next, who needs to defer? So syempre, kung meron kang symptoms na mukhang COVID, no? So likely di ka dapat pumunta dun sa vaccination post. If you have history of exposure to a COVID-19 case, syempre hindi ka dapat pumunta kasi dapat nasa quarantine ka. If you've been previously treated for COVID-19 in the past 90 days, the suggestion is to reschedule after 90 days. So it's hindi naman sa hindi ka pwede mabakunahan, no? But you need to be to reschedule. Have you received convalescent plasma or some antibodies? Again, reschedule after 90 days. If you're pregnant, reschedule only if in your first trimester. So kapag second or third, okay na, no? And then, have you received any vaccine in the past 2 weeks? Then reschedule. No? So maraming nagtatanong, dapat ba hindi ako magsabay ng vaccine? So ideally, what you just really want to happen at this point, because the vaccine is new, we don't want to have other confounders, kumbaga, di ba? For research, we use that term. Ibig sabihin, dapat hindi tayo nalilito kung yung naramdaman ba natin ay dahil sa COVID vaccine or dahil sa ibang vaccine, no? So, let's all take this into account as we plan our weeks, no? So, kung alam natin na mga June daw dadating yung bakuna sa city namin, o di if you need other vaccine like a flu vaccine, okay, take it in July na or earlier, 'di ba? May kung meron na or even April. So ganun lang naman. And then finally, if you have all of these conditions or comorbidities, remember, so pwede ka pa ring bakunahan. It's just that you need to get clearance from your attending physician. No? Hindi siya bawal. Again, it's not contraindicated. But it is your attending physician who's likely a specialist who will assess your case and recommend appropriately. So what should you do before vaccination? Obtain accurate information, verify what you read and hear, and seek consult from your primary care provider, and obviously declare your complete medical history. You also need to go to your assigned vaccination site on the day itself, but still doing the minimum public health standards. You will all be given a hard copy of a vaccination card that somewhat looks like this, but you'll also be given an electronic copy of this card. So kung mawala nyo, okay lang. No? So all of the LGUs and authorized vaccination sites that have been authorized by the LGUs will be providing this card. No? So because this is digitally generated, then you won't have this card if you're actually getting your vaccines from an unauthorized source. No? So at least yung mga legitimate private sector na nag-tripartite agreement, because they're going to be working with the local governments, they will also be getting this card. So what do you do after vaccination? Just make sure you finish the 2 doses unless you have been told to not take the second dose by the healthcare worker. If you report an adverse event, it will be investigated first, no? To know whether there's causality or just coincidence. Ito important, no? Kasi, for example, kumain tayo sa labas, dami pa natin ginawa throughout the day, and then in the evening, you got diarrhea. You can't automatically say it's because of what you ate, di ba, in the morning. So medyo kailangan mag-investigate ka ng konti, yun ba, or meron pa ba akong kinain na iba throughout the day, etc. So it's the same, no, for this. It's not automatic that, okay, I got vaccinated at noon, and then nung gabi, nahimatay ako, it's because of the vaccine. No? Hindi pwedeng ganon. So there's actually a group of health experts who will actually investigate whether that's coincidence or caused by the vaccine. So what should you do after vaccination? There are typical symptoms, and these are normal. No? So we reiterate, these are normal symptoms. So swelling, pain or redness, and it then becomes general symptoms of headache, fever, and fatigue eventually. But what needs to be very clear is that there are effects that are normal, which you will still need to get your second dose, but there are effects that mandate you or that require you to not get the second dose. And that's really just anaphylaxis or immediate allergic reaction. So kung makikita nyo, ano siya, no? So those are the symptoms that are in these second column. So I'll leave the slides with you so you can actually read more about it. But the main point here is that the symptoms on the third and fourth column are normal. No? They're normal, and that shouldn't worry us. No? It's really just part of the vaccination process. Okay, so after vaccination, can we not go back to wearing face mask, face shield, or physical distancing? Actually, no. I think many of you have seen this model of the Swiss cheese model, wherein it talks about layering of interventions. And in order to fully protect ourselves, the vaccines form just another layer. No? Hindi siya end all and be all of it. Pero kung mas simple lang, pwede din natin isipin, ayaw natin makagat ng lamok, di ba? And kung ayaw natin makagat ng lamok, we actually do a series of interventions like insect repellent, wearing long sleeve, wearing socks, using screens, etc. No? So it's all layering up rather than just focusing or putting all our eggs in one basket. Then finally, how can you ensure that your vaccines are authentic? We want to warn everyone that there's really no way for us to know whether that vaccine, the vial, still has the correct fluid inside, no? Except if first FDA has investigated or has authorized or has certified that that lot, no, that batch number, yung barcode group na yon, is actually authentic. And second, if we can ensure that kung saan man tayo nagpabakuna, yung nag-deliver po ng vaccine natin, na-ensure niya na it's actually in cold storage, no? And it's really in intact cold chain. Kasi kung any one of those wala, hindi mo talaga alam kung yung tuturok mo sa sarili mo ay tama pa ba, no? Or meron pa yung biological substance in it, or baka naging toxic substance na siya, which is mas delikado. So siguro I leave you here with one of the parang questions din sa akin before na, pwede ba if my friend or kamag-anak will bring me some vaccines pa uwi, no, from US or Europe, na lagay na lang sa maleta, no, or i-hand carry. Well, you've seen that the temperature requirements, as I've shown you kanina, is really very high, di ba? Malamig talaga yung kailangan. And there's no way that for a transatlantic flight at dadalhin niya sa airplane ay meron siyang refrigerator, no, na ganun kalamig. So whether magawa niya yun or hindi, malabas niya sa customs, hindi, likely sira na yung vaccine na yun. So really, it's not possible. No? So we have to really work with only legitimate, authentic providers and cold chain logistics managers. Yun. So finally, we wanted to ask all of you to become champions of the COVID-19 vaccines. We are providing here a link of all the materials we have been producing, and feel free to use them, put your logos, etc. And just, be very aware of how we influence other people around us. So if we feel that we're still not as well informed, then the suggestion is really to keep our opinions and inquire first before we declare that, oh yes, I'm gonna do this, I'm not gonna do this, because unknowingly we're actually influencing people around us negatively. So yun lang po. We thank you and PBSP again for this opportunity to use this platform, at maraming salamat po ulit.
Thank you, Doc Bev. That was very comprehensive and very insightful. I will let you catch your breath first and maybe drink water. You would notice that there have been several questions here on Zoom. We are also live on Facebook, on YouTube, and on Twitter. We tried to get to Friendster, Multiply, and GeoCities, kaso nagsara na sila, Bev. But there are some questions here. Just to structure the discussion, Doc Bev, and for our audience, the questions we're getting are of two sets. We have questions, I think, from the common tao, meaning how does this affect my family, myself, maybe my loved ones, and then there are more specific questions from our member companies and other corporations where some of them have signed up to certain vaccine brands, while others are considering to sign up in maybe those that are still opening up. Yung unang tanong ko sa iyo, Doc Bev, dun muna sa mga mas common tao questions. Some of these you were able to answer, or most of these actually you covered in your presentation, but we would like to reiterate the answers you got or you gave us. So the first one, this is from Roger Kadag of Lear Corporation. I'll read it verbatim. Hi, Doc Bev. I know maybe asking this too early. There are a lot of vaccines to choose from with varying cost and efficacy. To cut his question short, without looking at the costs, will Pfizer and Moderna be the best or most advantageous because these two have the highest efficacy rate? I know you guys might not want to mention any vaccine brand, and I do not want you to put you on the spot, but I just want to ask this question. His wife and two kids were once COVID positive. Sorry, Roger. I hope that's not too sensitive. And I do not want that to happen again to anyone. So yung tanong dito, Doc Bev, yung tungkol na sa mga either may kakayahan o yung mga kumpanya na gustong pumili ng vaccine. Meron ba silang dapat tignan na specific about those vaccines? Ano yung mas akma sa kanila at maybe sa pamilya nila, sa workforce nila?
Siguro, pwede mo siyang isipin, no, if we actually had a choice, di ba? Parang yun yung sa question mo. Una, balikan ko, no, yung different endpoints ng vaccine. Yung usual na nakikita natin na 94%, 95% that pertains to efficacy in preventing symptomatic infection, di ba? Hindi lagi nare-report yung efficacy ng preventing severe infection. So kunwari ako I have a lot of friends who are still frontliners, di ba? Healthcare frontliners. Ang mahalaga sa amin ay preventing severe infection, di ba? Kasi sabi nga, zero protection, like 50, 70, 80% protection is better than 0% protection, no? And every day when you see patients, the risk is like really just there. Do you have an option to wait out to choose? Maybe if you have, then lucky for you, di ba? Some of us pwedeng mag-work from home, so may opportunity to do that, wait it out. Pero most of us actually wala. Some of the economic frontliners really have to be out there exposed, no? And ang ano din talaga is they need a level of protection. And the question now is, what protection would we parang appreciate more or value more? Is it the protection against severe COVID or the protection against symptomatic COVID infection? So as I mentioned, sa amin, at least ako, speaking not as DOH but as a healthcare provider, as long as the vaccine can give 100% protection against severe COVID infection, kahit mas mababa siya dun sa iba, I'll take it, di ba? Pero here, you're talking about, so yun, we need to look at the two types of the efficacy rate.
Right. Salamat, Doc Bev. The next question I'll ask you, this is from Sixto Makasait. This is via Facebook. Sixto, magandang umaga. What is the definition of indigent population? And who or which agency of government will identify them? Is the vaccine free only for the priority groups?
So the policy direction of the government is the vaccines will actually be made for free, no, for all. So to a certain extent, that's true for the individuals, but maybe not true for the corporations that actually shelled out money generously for their employees, diba? Pero yun yung overall na policy direction natin. So kahit wala ka dun sa priority, dun sa remaining all citizens, dapat po maging free yung vaccine. Second, dun sa indigent population, typically po, it is DSWD. So we use the DSWD listahanan list for the indigent population. And then dahil po some of the LGUs, bumili rin po sila, merong mga LGUs that they have pre-identified their indigent populations on top of the usual DSWD list. So meron din po sila.
Okay, thank you, Doc Bev. This is from Tetyan via Facebook. Yung tanong naman niya, pwede kayang magpa-vaccine ng dalawang magkaibang bakuna, ibang brand? Like if meron kang trust issues dun sa unang vaccine, what are the effects? If meron kang pangalawa na vaccine na gagamitin. Can you mix the vaccines?
So currently, our experts, upon review of the evidence, they don't recommend this. So we're also not recommending this to all of you. So stick to one type of brand.
Right. Maganda talaga mag-stick to one, Doc Bev, no? This is from Macroni Malhin of Anslocor. Ang tanong niya, for private company, clarification, Doc, do we need to coordinate with our local government for the vaccination of employees if the company will go direct to the supplier?
So number one po, sir, I'm not sure if there's really such a thing as going direct to the supplier. Kasi if bibili po kayo, lahat po kayo dadaan sa tripartite agreement. No? So that's the policy now. Kasi if you will go direct to the supplier, it's also like saying, kung may mangyari dun sa mga nabakunahan, kayo po, no, your private company will be liable for it. And I don't think you want that to happen. So this is why you need to link with the national government and the local government. Second is, yes po, you will need to coordinate with the LGUs for the vaccination of your employees. Ngayon, yung siguro kailangan nyo rin po i-decide is, will all of your employees, if assuming you're all just in one office in one city, doon ba sila magpapabakuna, no? Kasi workplace nila yon. Or doon sila magpapabakuna sa bahay nila, no? Where they're situated. So mostly, most of the private sector groups have said na sa workplace, no, kino-consider yung employees nila. So if that's the case, as we mentioned kanina, 12 months po kasi yung monitoring, no, for adverse events ng mga pasyente. So you have to be able to turn over that list to a health authority. So, sino yon, no? So, kaya kailangan sa umpisa pa lang, nakalink po kayo. Second is, your employees will not be able to get the electronic vaccination card if you only administer it on your own. So, pwede naman din po kasi, basta kausapin yung LGU and then the LGU will say, ito yung mga options po, no? The LGU can say na hindi, dito na, no? Kasama sila dito sa vaccination post natin, bakunahan. Or the LGU can also just authorize you na, sige, sa site nyo, we give you access to this information system. So, ma-enter nyo yung mga names ng mga employees nyo na nakakuha. So, maraming options na pwede, pero sir, kailangan nyo talagang kausapin yung LGU kasi dun po matatrack yung mga nabakunahan. They all have to be part of the database. Otherwise, it's as if hindi po sila nabakunahan.
Right. Thank you, Doc Bev. For our audience, it's really...
At saka kung may adverse event na nangyari at wala sila sa database, walang help na mabibigay yung national government sa kanila.
Right. Thank you. For our audience, it's really bida ang lokal. So lokal talaga dapat ang kausap, whether that's businesses, or private individuals, families. Doc Bev, hindi to tanong ng audience, but I wanted to ask you, specific to companies who have signed up or who will sign up. Let's say, a very specific case, AstraZeneca, di ba? 17 million from local government and private sector. Eventually, meron ding AstraZeneca na procured by the national government. Tapos nabanggit mo nga, yung pagdating ng bakuna, hindi naman yung buong 17 to 20 million doses darating ng isang bagsak. So ang common na tanong din ng common tao plus mga kumpanya, local government, mauuna ba si national government, si local government, si private, o hati-hatian ba tayo, equal distribution ba tayo, depende sa darating ng mga doses ng bakuna?
So, yung nature lang, so nung una, medyo nalito din kami, no? Pero apparently, klaro naman sa suppliers kasi when they promise the vaccines, di ba? So at least for the tripartites with LGU and private sector, the promise of the companies was really third quarter, no? So nagkataon yung mga makukuha natin sa Covovax facility tsaka yung mga na-negotiate ng national government dahil earlier yung negotiation, earlier yung dating, no? So yung kung whatever makukuha natin ng first quarter and second quarter, those are national government bought, di ba? So that's why, for example, it will likely happen is that pag pumasok na yung stocks this March, April, May, talagang matatapos natin yung frontliners all over the country, tsaka medical frontliners, tsaka senior citizens. So the companies who allocated for senior citizens, likely nabakunahan na po sila through the national government stocks. So your stocks will likely be for all the others that's not medical frontliner and not senior citizen. So by way lang of their delivery schedule, it solved itself, no, the logistics.
Right. Thank you for that clarification, Doc Bev. Dito naman, I'll ask about, there's a question about adverse events or adverse effects of vaccine. So for example, you took the first dose, nagkaroon ka ng adverse reaction, totoong adverse reaction siya. Ano ang mangyayari sa'yo ngayon? Will there be another brand of vaccine for you, or does it mean hindi ka na pwedeng mabakunahan?
So if it's allergic type of reaction, di ba? So you'll actually really be assessed, no? Kasi kung nag-anaphylaxis ka, hindi ka makahinga, hindi ka talaga kukuha na ng second dose. And you will likely be scheduled for another type of vaccine, di ba? Pero kung depende, no? Kasi meron ding adverse event na mas minor lang, di ba? So pain, swelling, etc. In those cases, talagang you will still need to get your second dose to get the full effect.
Right, right. Actually, related to that, there was a question also from the audience. Paano kung hindi mo makuha yung second dose mo? Will there be still protection from the first dose? And if yes, how long will that last?
So to begin with, no, even if you get first and second dose, scientists are still studying how long really the protection will last. I think we need to be very forthright with this, no, because the earliest clinical trial studies happened less than a year ago. So the amount of follow-up time that we've had for those studies is actually really less than 1 year. No? So we can only say that the vaccines are working less than a year, di ba? So in latest statement ni DG Eric, it's around 9 months, di ba? But longer than that, kung sasabihin natin, ay, can the vaccines work for, assuming 2 doses, can the vaccines work for 5 years? We have no way of knowing, no? Kasi hindi pa umabot ng ganun kahaba yung trials. Second is, paano kung isa lang? So may studies ngayon, no, na lumalabas. I'm sure nababasa nyo sa news that, mukhang 1 dose lang, pwede na. But it's still not recommended, no? There are studies around it. So it might, no, ang alam natin ngayon is science is really evolving. Sobrang bilis. We are being very, trying to be agile with our experts also. So kung may dumating na ebidensya, review. If not sufficient, then let go, di ba? Pero for now, ang status quo natin is 2 doses tayo for you to get the full protection.
Salamat, Doc Bev. Let me emphasize what you said, that the science is evolving. So there are still things we don't know, and that's okay. But there is a process for us to understand what's happening and make the appropriate decision, whether in government or in the private sector. I'll go to, again, more specific and personal questions. We have a question from Arthur Uy of My Hotel, not a relative of mine. Tanong ni Arthur, is it safe for a cancer survivor to have the vaccine? Maybe you can also speak about other comorbidities or conditions where there might be red flags or considerations for vaccines.
So generally, as I've shown you the algorithm kanina, no, basta you fall into that last box of meron kang mga comorbidities, the advice is really for you to seek consult from your attending physician. Bakit, no? It's very difficult to give advice without knowing your full history, di ba? So, may assumption tayo na kung may comorbidities ka, kunwari may cancer ka nga, meron ng oncologist na talagang tumitingin sa'yo. No? And the different medical societies now are also doing their part and actually assessing their more detailed guidelines. So it's their specialties that will help you decide, no? Yung mas detalye na pros and cons, etc. Sila po yung magsasabi sa inyo. So medyo wala pong shortcut, but you really need to see your specialist.
Right. Thank you, Doc Bev. Magra-rapid fire ako. Let's do a hard stop for after 3 minutes. So may question dito about the funding for the vaccines. We know it's 82.5 billion pesos based on figures reported by Secretary Galvez and by other persons in government. So there's just a question, lahat ba ng pondo na to ay galing sa loans? That's the first one. The second question naman, this is from Attorney Erwin Gavino from DG Law. Ang tanong ni Attorney Erwin, is the vaccination program a continuing program specific to COVID-19 vaccines? And will that carry on for how many years, for example, if it's a multi-year program? And then lastly, this is from Danny Cabrera of Air 21. How does the Department of Health or the local government unit manage to ensure that patients are inoculated with the same brand of vaccines as their first dose, for example?
Okay, I'll answer the last question first. So nasa planning part po, no? So if we get, sabi ko nga, 100 doses, we plan for 50 lang. Kasi nakatago na yung 50 for that same group of people. Kasi hindi natin ma-assure kailan po dadating yung next stocks, di ba? Dahil nagpa-fluctuate, no, yung pag-deliver sa atin. So we plan always to assume na covered na agad. Second, dun sa vaccination program is a continuing program. Sir, as we mentioned, no, hindi natin alam. So ngayon po, the target lang is within the next 3 years, every Filipino will be vaccinated. No? Best case scenario yon kasi depende siya sa stocks na dumating. Most should have been vaccinated next year, tas may siguro konting matira for 2023. Pero kung dumating na lahat ng stocks next year, tapos na tayo next year. Now the question is, para ba tong flu vaccine na taon-taon na tayo magkakaroon? It's a question that the science still needs to answer. So, di pa natin yun alam. So, for now, we're planning one round just to complete all Filipinos. Loans, I won't be the best person to answer it. There are some vaccines that might be that we might tap budget to buy, no? Pero ibig sabihin, free money pa siya ngayon, hindi pa po siya pwedeng i-commit kasi sa budget natin, kailangan tapos na yung EUA, etc. No? So lahat ng pinang-negotiate natin for now, loans po. Kasi by procurement law ng Pilipinas, hindi mo siya pwede gamitin for things na wala pang permit, etc.
Right. Thank you, Doc Bev. Let me just quickly add to it. At least the public data available to all of us, we know government would like to procure or source 148 million doses. And I think that already includes support of private sector and local government. Tapos meron pa pong 44 million doses na darating mula sa Covovax facility. Ito yung libre galing sa Global Fund nga ng mga bakuna para sa mga mas mahihirap o developing na bansa tulad ng Pilipinas. So, base dun sa mga numero na yon, it seems we expect anywhere from 148 million to 192 million doses for the Philippines. Yung last question ko na lang, Doc Bev, this is maybe provocative. Can you comment on the seeming delay of the arrivals of the vaccines? There were previous statements by government that the vaccines will arrive this month. Can you give us the status of these deliveries, and are we still on track to meet the targets for vaccination in 2021?
I think what we can say lang is that we're being very careful. It's always a two-way street, no? So sa side natin, we try to complete all the documentary requirements that are required of us, but certain instances also make the other party a bit more cautious, no? And if they add more requirements for us, then we have to comply because we're the ones needing the vaccines, di ba? So parang I think the way to look at it is really, first, the supply is not in our hands. We did what we can to negotiate, to do the complete staff work, but may iba yung may hawak ng supply, no? So we do our best. Kung may hiningin pa sila ulit, we provide the additional requirements. It hasn't been easy, but we hope na lahat ng pag-iingat will prevent bigger issues in the future.
Right. Thank you, Doc. Doc, maybe you would have one final message to all of our participants, even those who will view this as a recording later on.
Yes, thank you. On behalf of the people working here at the Department of Health, we would like to thank all of you for, first, your patience. Second, for having the interest, no, to go through this webinar and really learning about how the COVID-19 vaccine rollout will be, and hopefully use whatever info that you've obtained here to inform not just yourself, your family, but your coworkers and community members. At this point, parang klaro po sa amin na yung vaccine confidence, hindi po natin siya, yung target natin, hindi natin ma-achieve kung TV commercials, radio commercials lang yung route natin. It really requires us to have constant dialogue, lalo na marami pong nagbabago araw-araw na siyensya at mga developments, no? And we hope we could maintain we're very transparent in the process, open lines of communication. If some of you might need help in cascading info, etc., please feel free to reach out to us here at the DOH. We have a task group on demand generation. We also have a lot of materials to share with you if you wish to conduct information sessions for your employees also. So yun lang po, we're all going to be in this together. Hindi po to government lang. It's really a partnership as mentioned kanina. So we look forward to working with all of you as we approach the actual implementation of COVID-19 vaccine program. Thank you very much po. Thank you, Elvin.
Maraming salamat, Doc Bev. I will be remiss if I don't acknowledge our common alma mater. Shout out to Tiongting. And thank you again, Doc Bev from the Department of Health. Ingat kayo. Good luck with all the work. At maraming salamat sa lahat sa inyong mga tumutulong sa atin at sa kagawaran ng kalusugan. Thank you, Doc Bev. Now, for our next presenter and next resource person, she is the medical director of the RightMed Group. She will give us updates on the Covovax vaccine. Just to give you some of her experiences and credentials. She is a graduate of Pamantasan ng Lungsod ng Maynila College of Medicine. She finished her residency in the pediatrics and fellowship training in the Pediatrics Infectious Diseases at UP Philippine General Hospital or PGH. She is a fellow of the Philippine Pediatric Society and Board of Director of Pediatrics Infectious Disease Society of the Philippines. She is a part-time faculty of PLM College of Medicine and a past clinical trialist for pediatric and rabies vaccine. And obviously, she is a vaccine advocate. So again, let us give a warm welcome to Dr. Nancy Bermal, Medical Director of RightMed Group.
Excited ako, Elvin, obviously. Thanks so much for the kind introduction. And thank you so much also, Bev, for your presence today. You have cleared so many questions. And for my part this morning, so I really thank PBSB for giving us this opportunity to share with everyone the data on Novavax. So I'll start sharing my screen. Okay. Can you see my slide?
Yes, Doc, we can see it.
All right. So again, we had a very good discussion with Bev. So for my part, I mentioned we'll be sharing the data on Novavax. So for my disclosure, I'm a current employee of Unilab. So for the outline, I'll be discussing the Novavax vaccine platform, the clinical development plan, the preliminary analysis of the phase 3 trial in UK, and also the phase 2B data in South Africa, and an update on the US-Mexico phase 3 trial, as well as the planned booster and bivalent vaccine. Then we'll give it a summary. So if earlier, Bev gave us background about all these vaccine platforms and about the data that should be collected to demonstrate the safety and efficacy of all these different vaccines. So focusing on this Novavax, this is the company which developed the Covovax vaccine, and the Serum Institute India partnered with Novavax to manufacture the vaccine in India for emerging markets. And siguro para maintindihan natin, where is Unilab there? So Faberco Life Sciences, which is a company here in the Philippines, partnered with Serum Institute India to apply for the emergency use authorization here in the Philippines and to distribute the vaccine to the government market. Unilab is coming in as a partner of Faberco to distribute the vaccine to the private market. Okay, so at least medyo may idea tayo paano pumasok si Unilab into the picture. So for this morning, I would like to focus on yung mga requirements ni Bev kanina on the different vaccine platforms. So for this Covovax vaccine, this utilizes protein subunit plus an adjuvant to protect against COVID-19 infection. So Bev earlier also mentioned about the spike protein. No? This is the virus infecting cells. Now we use the surface protein to attach and infect the individual. So common sense that if this spike protein, siya yung kalaban, no? That's the major kalaban na sinasabi ni Bev kanina, no? That's a thief in the night. So the manufacturer, by recombinant nanoparticle technology, no, they developed this vaccine from the spike protein, no, the virus surface protein, to stimulate the immunity, but not causing infection. So apart from this, no, getting that surface antigen, they also used a matrix M adjuvant. So this is a proprietary adjuvant which can provide better immunity. No? So kanina sabi ni Bev, once you inject the vaccine to a person, nandiyan na yung mga antigen-presenting cells. No? So what the matrix M adjuvant does is to parang get more of this antigen-presenting cell to parang welcome this vaccine, no, this antigen, and bring it to the other immune cells like yung lymph nodes, no, where all your T cells and B cells are present, so that the person will eventually develop the necessary antibody so that when this threat will come in, these antibodies will attack that virus. Okay, so in the end, no, the manufacturer was able to develop a recombinant nanoparticle with the matrix M adjuvant, which is pre-mix, no? Hindi mo na siya kailangan, hindi po siya magkahiwalay. It's there in one vial, and this preparation is stable using the standard refrigeration of 2 to 8 degrees centigrade. Okay? So yan po yung bakuna na Covovax. So it uses the protein subunit, no, particularly the spike protein mixed with an adjuvant to make it more immunogenic, especially those who are elderly and those with immunocompromised conditions. Okay. So I would just like to share with you, no, the development platform that is being followed by Novavax company before they can, apply for a registration. Yun nga, no, because we are now in a pandemic, apply for an EUA. So having said that we are in a pandemic, we really need a vaccine to be available, all this company needed to follow the strict development platform, no, before they can apply for an EUA, because we're giving vaccine, and above all, we shouldn't do harm, no, to our population, because in vaccines we give them to healthy individuals, no. So kailangan nga we will be ensuring the safety of all our vaccinees. So I would just like to highlight, no, that this company started, no, with the phase 1 study and then went on to do the phase 2 trial. And if the phase 2 trial was able to demonstrate enough safety and efficacy for all these vaccinees, then they can proceed to a phase 3 trial where they will be enrolling more participants. So these 3 lines here, no, these 3 bars here will be the immune bridging studies that will be done where the vaccines will be manufactured, such as in India, in Czech Republic, in Japan, no? These vaccines will be manufactured. So it's important that they will also get safety and immunogenicity data. Okay, let's look at each one. Okay, so for the phase 1 that was done in Australia, they enrolled 131 participants aged 18 to 59 years of age. So for this study, first and foremost is they want to ensure that the vaccine is safe, and the participants would be developing antibodies, no, from getting this vaccine. So the phase 2 proceeded also in Australia plus US. They enrolled 1,288 participants aged 18 to 84 years. So if you notice, no, meron ding age escalation for clinical trials. So you want to ensure safety of all these participants from 18 to 59, and once they have this data, they can now increase the age indication, and particularly for this vaccine, up to 84 years of age, and they have more than 600 participants belonging to the elderly population that is 60 years and above. And then I'll be discussing about the phase 2B and phase 3 data from UK, where they enrolled about 15,000 participants, also including elderly population, and a little update about the phase 3 study in US and Mexico. Okay. So in the phase 1 trial that was done in Australia, so the conclusion from that study is the vaccine is generally well tolerated. Majority of the subjects reported none, or if there were some adverse reactions, they are categorized as mild. No? The usual pain or fever, mild fever, or swelling or tenderness at the injection site. There were no adverse events of special interest. So may certain category din ng adverse events. No? Pag sinabi mong special interest, these are not the usual like hypertension, diabetes. This can be related to some immunodeficiencies. But for the phase 1 study, there were no reported adverse events of special interest. And there were also no adverse events that caused suspension of the trial. And also from this phase 1 data, the vaccine was able to elicit robust antibody response, even superior to the COVID-19 convalescent sera. So almost, not almost all of the participants had a seroconversion rate of 100%. So paano nila tinitignan yung seroconversion rate? So before a vaccine is given, so they will determine the baseline IgG or the immunoglobulin G. And then after 2 months or 7 days from the second dose, they will again determine the amount of antibodies. And they noticed that all participants had 100% IgG seroconversion. For this particular vaccine, they also want to know the immune mediated response from the vaccine. So they're getting the CD4 and T cells induced protection, as well as the T helper 1 responses. And because of the adjuvant that was added, so the conclusion there is the vaccine was able to elicit strong T cell response because of the adjuvant that was added to this vaccine. Okay. And from the phase 2 design and status that was done in Australia and US, so this trial was done in August. So medyo late siya as compared to the mRNA vaccines from Pfizer and Moderna. So from this trial in Australia and US, they enrolled participants 18 to 84 years of age, and the primary objective of that study is to look at the safety and immunogenicity of the Covovax vaccine. And more than 50% of the participants belong to the elderly population, 60 years of age. Now, we always highlight about the profile, particularly what's the safety and immunogenicity profile for the elderly population. And from that study, the conclusion was the vaccine was well tolerated with local and systemic side effects, which are categorized as mild. But these local and systemic effects, there were more reported among the elderly population and also after receiving the second dose of the vaccine. And there were no adverse events also that caused suspension of the trial. So from this study, the company also looked into the dose finding. So from this graph, you can see that 2 doses were administered in 2 different formulations. One is the 25 microgram plus the matrix M, and another dose was 5 microgram plus the matrix M. And they also look at the data after giving 1 dose at 25 microgram and also 1 dose at 5 micrograms. So based from this anti-spike IgG, the responses from getting the 25 microgram and the 5 microgram were similar. So the company for the phase 3 studies and even the phase 2B in Australia utilize this dose. No, the lower the dose, where you can achieve the same response, will be used for a subsequent trial. Okay, so 5 microgram plus the matrix M given 2 doses. So these data are all published if you want to check, no, from peer-reviewed journals such as the New England Journal of Medicine. So the phase 1 and phase 2 studies are already published and peer-reviewed. So this is very important, no? So experts can take a look at this data and do critical analysis whether what the company is telling is really true, no? And for this company also, they have the website, novavax.com. They also publish there all the protocols. So I think that's really very good, no, as far as transparency is concerned. When they release the data, we can always check whether this is really part of the objectives and included in the protocol. For the phase 2B study that was done in South Africa, so it also started in August 2020, involving 4,400 participants. And the main goal of this study is to look at the efficacy, the safety, and immunogenicity among healthy adults and also participants who are HIV positive. So why is this important? No, at least we can know how the vaccine, no, can the safety and efficacy for this group of immunocompromised individuals. So the complete results will be released this February, but we can share with you the interim data from this trial. So also important information from this South African study was during the time that they were collecting, the efficacy endpoint, which is the number of PCR positive participants, no, symptomatic PCR positive. So yun yung kailangan nating malaman, no. So how many of these participants, no, either in the placebo group or in the treatment group who were given the vaccine will develop COVID, no, symptomatic and PCR confirmed. At the time that they were collecting this information, the South African variant was the predominating strain, no, at the time that they were looking at the efficacy of this vaccine. So, what was the data? No, sabi kanina ni Bev, so when we talk about efficacy, this is overall, no, the ability of the vaccine to prevent mild, moderate, and severe infection among all the population. No? So for this particular trial in South Africa, the overall vaccine efficacy is 49.4%. So you can see here among those given Covovax, 15 developed PCR confirmed COVID, and among the placebo group, 29 developed PCR confirmed COVID. But when they look at the subgroup of population who are HIV negative, the overall vaccine efficacy is 60.1%. No? So we don't have yet the data, no, as to the efficacy against mild, moderate, and severe COVID. So we can share with you once we have all this data. So again, this is the first company which demonstrated efficacy against the South Africa escape variant, because 93%, no, of the samples which were sequenced were attributable to the South Africa escape variant. No? So, well, sabihin natin, it's only 49.4% efficacious, but when you exclude all those HIV negative, the efficacy is 60%. No? So for the phase 3 trial, the company has 3 phase 3 studies, ongoing studies in United Kingdom, in US and Mexico, and the one in India. So in the UK study, they also enrolled 18 to 84 years of age, and the full enrollment has been completed. And part of the data that we can wait from this study is the co-administration of COVID-19 vaccine with flu. I think that's one of the questions earlier. But I would just like to say, for now, the recommendation is to give it 2 weeks apart. But once we have this information from the UK study, so we will know if the safety and the immunogenicity will not be affected by the co-administration of the COVID-19 vaccine and the flu vaccine. And the US and Mexico study, the enrollment is also finished. And from this study, they were able to enroll at least 65 years of age participants, also with high-risk conditions. And later, I can show you at least the profile of the participants from the US and Mexico study. From the phase 3 UK trial, the company released the interim analysis data last week of January, and it's encouraging to have this efficacy and safety data. So from the phase 3 UK study, they enrolled 15,000 and randomized 1:1, meaning 7,500 got the Covovax vaccine and 7,500 got the placebo. So the primary endpoint of this study is the number of PCR positive symptomatic, mild, moderate, or severe COVID-19 illness diagnosed more than or equal to 7 days after the second dose. So all these participants will be monitored. If they develop symptoms, whether it's mild, moderate, or severe, a PCR, a swab will be done. And then for this study, they were also to get the efficacy against the UK variant strain. Okay, so let's look first at the primary endpoint. So the vaccine efficacy overall against mild, moderate, and severe COVID is 89.3%. So 6 participants developed COVID who received the Novavax vaccine, and 56 developed COVID in the placebo group. But if we look at the primary endpoint against mild, moderate, or severe, we can see here by eyeballing, none of those who received Novavax developed severe COVID, giving it 100% efficacy against a severe COVID infection. And noteworthy also, at the time that they were getting the efficacy data, 50% of the cases were attributable to the UK variant strain. So we can see further what is the efficacy against the UK variant strain and also against the usual or the ancestral strain. So we can see here that 56 of the 62 cases were they were able to sequence 56 out of the 62 cases, and the efficacy data against the ancestral strain or the usual COVID strain is 96%. But if you look at the efficacy against moderate to severe infection, it's 94%. But if you only check the efficacy against severe, it's 100%. Okay. What about the efficacy against the variant strain? So for the primary endpoint, meaning the efficacy against all the types of COVID, it's 86% efficacy. And against moderate to severe COVID, the vaccine is has 87% efficacy against the UK variant strain. So this is the first company which demonstrated actual efficacy data, because at the time that they were collecting all this data, the South Africa and the UK variant strains were the predominating strains in South Africa and in UK. Okay, so what about the safety profile? So we can only share high-level safety data from the UK trial, the safety against or the reported severe treatment emergent AEs. So how do we define severe AEs? So if the participant is not able to do the usual daily activity, so that's classified already as a severe AE. So among those who received the Novavax vaccine, the recorded rates is 1.1% versus placebo of 0.7%. And with regards the serious treatment emergent AE, so when we talk about serious, no, the definition is the adverse event can lead to hospitalization or can lead to is life-threatening or can lead to prolongation of existing conditions. So if you look at this data, the serious treatment emergent AEs between two groups are comparable. No? So meaning whether the participant received the Novavax vaccine or received the placebo, the rates are similar, which is also the same as the rates for the medically attended AEs. So these participants, no, once they get AE or adverse events, they go to the clinical trial site to have consultations. So if you look at this data, it's almost similar between the two groups. Okay. So as mentioned, we don't have yet the details of all this medically attended AEs. But from the phase 1 and phase 2 trial, majority of these AEs are mild. There were no severe AEs, and most of these systemic adverse reactions are headache, fatigue, muscle pain, which Bev mentioned earlier. These are the expected systemic reactions from almost all vaccines. Huh? Okay, so what about the US phase 3 trial that is ongoing in US and Mexico? No? So if you're interested, you can also take a look at the protocol from the Novavax website. So from this trial, no, they enrolled 30,000 adults, more than 18 years and above. So the interim analysis will be done once they recorded 72 PCR confirmed cases. So that's actually something we're really looking forward to know what's the effect, the efficacy of this vaccine. We know that US is the number one in terms of the number of cases. So it's really something to look forward to, the data, no, from this US study. So, but what we have right now are just the profile of these participants, no. Diverse yung population. They have enrolled Latin Americans, African Americans, Native Americans, and also Asian Americans. And 13% of this population belong to the elderly group. No? So we can see the data on the safety and efficacy among this vulnerable population. So the company is also addressing about our common question, no? How long is the efficacy of this vaccine? Is it 1 year, 2 years? So actually in the phase 3 trial in US, they'll be monitoring all these participants for 2 years. And they'll be also getting the antibody levels after 1 year. So the company, recognizing the current concern of mutant strain, they're also preparing, no, bivalent vaccine, which can address the problem of mutations around the world. So the lab scale manufacturing is underway for multiple strains, and clinical testing can be expected sometime Q2 this year. So that's also something to look forward to from this company. Okay, so in summary, Covovax is developed using a well-established technology. So yeah, just to highlight, the protein subunit platform with adjuvant, it's not new. In fact, we have adjuvanted flu vaccine available in US, no, in some other parts of the world. And the protein subunit is also new. This is the technology that is being used to develop hepatitis B vaccine, as well as your human papillomavirus vaccine. So meaning this technology has established data as far as safety and immunogenicity is concerned. And also we mentioned about that this Covovax vaccine was the first vaccine was able to demonstrate, no, the efficacy against the UK and the South Africa COVID-19 variant strains, meaning there's cross protection from the usual strain and the variant strains. So The vaccine is well tolerated with 0 to mild adverse reaction, and there's potential for use among the elderly and also among those with comorbidities and even those with immunocompromised condition. And the preparation, it's fully liquid with storage of 2 to 8 degrees. And the preparation comes in a 5 ml dose vial. So each vaccinee will be given 0.5 ml per dose. So meaning in one vial, you can schedule 10 vaccinees in one day. And the regimen is 2 doses, 21 to 28 days apart. So I would just like to end, no? We already have a lot of information about all this different vaccine, but these vaccines will not save lives, no, if it remains to be a vaccine. But vaccination will save lives. So thank you so much for your attention.
Maraming salamat, Doc Nancy. I hope you can stay for a bit of questions from our audience.
Sure.
Yes, thank you so much. So, right, while we are sorting out the screen, Doc Nancy, there's a... Okay lang po, Doc. That's fine.
Baka ayaw niyang magbalik. Okay.
Wait. Let me do it for you, Doc.
Okay,
Yeah.
yeah. Thank
Right,
you.
right.
Thank you so much.
Ano tayo, Doc? Self-service tayo dito. So the first question from our audience, this is from, wait, let me go back to the questions. This is from Marie Chris Valte of Kasaganaka Development Center Incorporated. When does the Covovax vaccine expect to secure WHO emergency use authorization? As far as I know, the lab data has not been submitted to WHO for experts' assessment.
That's right. So they have not submitted to any regulatory agency, but they have started rolling submission, meaning like the good manufacturing documents they have submitted here in Philippine FDA, in UK, in Canada. But once they have the complete analysis from the phase 3 trial from UK, so this can be reviewed by our authorities, no? And parallel, they can also submit to WHO. But at this point, you're right, no? There has no submission yet to any regulatory authorities of the complete data.
Right. Salamat, Doc Nancy. This was a question it was based on our conversation prior to the start of the session. You mentioned that RightMed, Unilab are also helping the government and the DOH with the communications campaign to convince Filipinos na ligtas ito, safe, at kailangan pagdaanan. We have a number of questions from the audience about vaccine hesitancy and how they can either convince themselves, their families, their colleagues, their companies to get vaccinated. Doc, maybe you could say a bit about what can we do at our level to address that.
Yeah, so I think the general key message here, as far as the Philippine vaccination plan is concerned, we have experts, no, as mentioned by Veb, no. So the vaccine expert panel helps the Philippine FDA to review safety and efficacy data. So that's one layer of review. We also have the HTAC, the Health Technology Assessment Council, helping to review also what vaccines will be bought by the government. And I think yun yung issue ngayon yung brand. Okay? So kasi yung key message natin, coming from a zero protection, and as per WHO, any vaccine which can demonstrate at least 50% efficacy and can demonstrate good safety profile can be given an EUA. So dun kasi nanggagaling yung uncertainty. And we also had several town hall meetings, no, before the scientific data, like what are vaccines, yung sinabi ni Bev kanina, no, what are vaccines, how vaccines work, no, what are the different vaccine platforms. The likelihood that the participant will get the vaccine will range from 50, no? Pinakamataas yung 50% of them will likely get the vaccine. But after getting all this information from experts, it goes up to 80, no? 80%. So meaning kailangan talaga siguro we can do more education campaign, no? Doon sa level natin. In fact, even among family members, if you can only assure them that these vaccines have undergone stringent clinical development, stringent review for our experts, no, siguro yung confidence ng vaccine will be there. And alam naman natin yung reason why we have this problem of vaccine hesitancy, no, because of that Deng-Vaxia problem in 2018. Iba naman po yung sitwasyon na yon at iba naman po itong pandemic na to, no. So we can only be successful in controlling the pandemic if everybody will cooperate, no. Kasi baka nandiyan nga yung bakuna pero ayaw namang kuhanin. So wala, vaccines will not save lives, but vaccinations will, no. So I think yun yung pinaka-key message natin doon.
Salamat. Salamat, Doc Nancy. Another question, this is from an anonymous participant, but from one of our member companies. His question or her question is, once available, referring to Covovax, how do companies place order or secure their doses for the vaccine?
I think si Kay De Jesus's part of the team also can better provide you the answer. Kay, are you there? Kay?
Okay, you can turn on your video and your mic so we can feature you both on Zoom and all the live streaming platforms that we have now. So we're on Facebook, YouTube, Twitter. Alam ko nag-ayos ka, Kay. So papakita na natin.
Okay, there. Yeah.
Yeah, hi. Good morning. Sorry, ang bagal. Ang bagal ng internet connection. LV, I'm sorry, can you repeat the question?
There's a question from one of our member companies. Once available or authorized, how can companies secure their doses of Covovax?
Oh, okay. So actually, at this point, we are already partnering with companies, with private companies, if they are interested in pre-ordering Covovax. If it is already available here, chances are somebody would already own it because we are doing pre-orders. So I suggest that if they indeed plan to purchase or pre-order the product Covovax for their employees and their families, for example, they can already get in touch with us. Maybe Alvin, later you can provide them with the email address that they can communicate with. Okay, thank you.
Yeah. So Elvin, just to emphasize also, no, we're aligning with the DOH deployment plan, no. So para kasi like also the prioritization where the vaccines will be given. So ina-align din po lahat yan ng Unilab, no, to whatever DOH will recommend, no, down to the level of the prioritization. So para hindi magulo yung vaccination program. Meaning if in the company, let's say meron kayong mga senior citizens din doon, or if you have frontliners, unang-una, no, healthcare frontliners, sila din po yung mapo-prioritize as senior citizens, those with comorbid conditions. So we're requesting also these companies to also do that prioritization if they decide to order through Unilab.
Right. Doc Nancy, this is from Facebook via K-Co-op, an organization we also work with. Ang tanong po nila, from the earlier presentation of Doc Bev, it is important that all initiatives by employers to make sure that the LGU is informed and that those vaccinated be included in the government database. Will this be done by the employer? Will it be Unilab assisting in this aspect? Will it be the local government? Will we get clear protocols on how employer-initiated vaccination be implemented or carried out?
Yeah, that's a good question. No? So as far as the initiative of Unilab, no, our corporate IT is coordinating with the ICT, no? Kasi yun yung gagamitin nating system, yung VIM. So mention nga ni Bev, no, so each company can come up with their own process on yung enlistment, no, yung screening, pero in the end kailangan nating i-interface dun sa VIMS IR. syempre yung isang responsibility din ni Unilab is to also guide, no, the other companies on how to go about this. But as mentioned nga with Bev, yun din yung kino-communicate namin as far as we will be supplying the vaccine and deliver this to hospitals, no, na malapit dun sa workplace. Just in case hindi ganun kadami yung employees from that company. So it's really better to coordinate this to the LGU. Yun yung kino-communicate din namin, no. But the delivery of the vaccine will be in the hospital. Kung ma-approve man, no, kung marami talagang empleyado at ma-approve, let's say, sa mga other healthcare facilities such as clinics, no, basta inallow ng DOH, the vaccine will be delivered there. But at this point, baka mas maganda na talagang mag-coordinate sa LGU. But we will let you know po, no, once na ayos din ng Unilab, yung interface with VIMS IR, no.
Right. Thank you, Doc Nancy. For the benefit of our audience, VIMS IR is vaccination Information Management System -IR, that is Immunization Registry. Ito po yung tala national na mga taong mababakunahan at nabakunahan. So this is going to be what government refers to as the master list of the 70 million or so Filipinos who we hope will be vaccinated. There's one question here from Air 21, Danny Cabrera. I think this is a common misconception. So dito ang tanong ni Danny Cabrera, is Covovax project the only ongoing undertaking sponsored by the Bill and Melinda Gates Foundation? Will these definitely be provided for free for all governments, including the Philippines? Danny, yung Covovax, ito yung brand ng vaccine na galing sa Novavax at ng Serum Institute India. Ito yung in-explain sa atin ni Doc Nancy. Yung COVAX facility, COVAX, walang VO. Yun naman yung effort ng buong mundo na magbigay ng libreng bakuna sa mga low-income or middle-income na mga bansa tulad ng Pilipinas.
Yeah, right. So
Right. Doc Nancy, maybe as for, here, there's a question from May Herson. Actually, project staff namin mula sa Mindanao. Ang tanong po niya, if the single-dose brand provides more than 50% efficacy, Doc, will that be more cost-effective to use than the two-dose brands? And will there be less discomfort or adverse events, especially for senior citizens?
Yeah, that's a good question, no. So currently, no, yung J&J lang, yung may data after one dose, but the company is also doing clinical trial, giving 2 doses, no. So ang sagot doon is antayin natin yung recommendation ng mga company. So now we hear Pfizer is getting the efficacy. Actually, you call it effectiveness na kasi real world na siya, no? After one dose. But we have to remember that the trial, that the data that they presented is using 2 doses, no? 2 doses. Okay? So the recommendation should always be based on science. If after one dose, the efficacy will be the same after giving 2 doses, then the company can say, okay, let's just give 1 dose. Okay. But for now, what is written in the EUA in the Philippines and other parts of the world for all this vaccine, to achieve the maximum efficacy, you have to give it 2 doses. So yun muna po yung susundin natin. And depende din yan, no, sa regulatory agency. So in UK, iba naman yung vaccination program na ginawa nila, di ba? In some parts of Europe. So binigyan nila all the vulnerable population. Tignan natin, no, kung made-decrease ba yung COVID cases. And then we'll decide whether to proceed with the second dose or give 1 dose only to the rest of the population. So kanya-kanya po yan na strategy. Pero tayo ngayon, we follow what the manufacturer's recommendation to give 2 doses. Even if may lumalabas na data na 54% effectiveness, no, after giving one dose. So science-based po lahat ng magiging recommendation natin.
Right. Thank you, Doc. For our final question, this is from Tops Pagaduan via Facebook. How can we be sure that our employees will receive Covovax if it's the national government or the local government who will decide what to give? Meaning, yung nabanggit kanina ni Doc Bev, na yung libreng bakuna ng gobyerno, walang choice yung mababakunahan, di ba? Kung ano yung available sa kanya, at after consultation, kung ano yung ligtas para sa kanya, ang vaccination site at yung doktor doon ang magpe-prescribe or magsasabi na, okay, ito na yung para sa'yo.
So actually, Elvin, no, yung program na to for the private sector, we supplement, no, kung ano yung ginagawa ng gobyerno. Kasi alam naman natin, hindi naman kaya talaga gawin lahat, no? So as Bev mentioned, ang i-prioritize talaga muna will be the frontline healthcare workers, and then the senior citizens, the elderly. So kung mabigay na yun lahat, at let's say, di ba, hoping against hope, dumating din yung for the private sector. We can do, I think, Bev, I will agree, parallel vaccination. No? Kasi ang goal din naman natin sa private sector is to support what the government is doing and also to help our economic frontliners get the earliest protection. So ako personally, yun siguro yung pwede nating masagot na paano makukuha ng mga empleyado, ng mga economic frontliners kung what we're saying is uunahin talaga. And yun naman yung sinusupport natin, no? Unahin yung healthcare workers, the senior citizen. Pagtapos na yun, baka pwede na tayong sumabay, no, na bigyan din yung ating economic frontliners, which is also part of the priority A din naman, no? Nasa priority A din naman tayo. Siguro yung ano bang masasabi natin dito? Ang una-muna nating unahin, kasi kanina yung tanong, paano kung hindi mo gusto yung naka-allocate sa'yo? May informed consent po yan. Pero what we're saying here is, pag nilagay na yan ng gobyerno sa vaccination program, na-vet na nila yan, no? It's safe and effective. Ngayon, for some reasons, no, hindi naman natin mapipilit na ayaw mo talaga yan. So magwe-waiver ka din. And then, dun ka sa huling priority list na mapupunta na hindi mo alam kung kailan yon. So once you're offered, actually yan din yung sinasabi namin even for our employees in Unilab, especially the doctors. No? We have doctors in the company na tumitingin ng mga COVID patients. So what we're telling them, if you have allocation in the hospital, get it, no? Get it. Huwag mo intayin yung huwag mo intayin yung ating bakuna kasi best case, it will arrive Q2. So kung ikaw at risk at talagang nandun ka, no, sa PGH ka or lung center ka, no? So get the vaccine. So gano'n naman din po yung communication na ginagawa namin, no? Kasi the earlier you get the protection, the better.
Thank you. Doc, sorry, may pahabol ako. This is from Adet Dizon of Mercury Drug Foundation via Facebook. Hello, Adet. Ang tanong niya, additional question, do the private companies need to engage in tripartite agreement before they order or secure Covovax? Or will the suppliers do that on behalf on their behalf?
No. So si Novavax, the Faberco will have a tripartite agreement. So aligned po tayo lahat dun sa nire-require ng government. So we can only distribute Covovax to the private market if we will be allowed by the government. So kailangan may tripartite agreement, and kailangan meron na rin tayong EUA, no? We will follow all the government's requirement, including seeking the EUA, which will be done by Faberco.
Right. Okay, Doc Nancy, maraming salamat. Maybe you have a final message to all of our audience.
Yes, so thank you so much po for joining us in this webinar. So as a vaccine advocate, we always say na we are in a pandemic, so let's just help in providing the right information now until we have received the vaccine. Kasi yung ating trabaho will not end pag nandiyan na yung bakuna, no? it will continue because these vaccines are under EUA. So we really need to see the effectiveness and the safety of this vaccine after we have received it, no? Sabi nga ni Bev kanina, after 1 year. So we really need to be proactive. So just in case you develop symptoms or any adverse event, so don't hesitate, no, to report it to the healthcare facility, to FDA, to the manufacturer. So ilalagay naman lahat yan, no, yung contact information. So siguro ang pinagdadasal na talaga natin ay sana masimulan na natin yung pagbabakuna. Pero kahit nandyan po yung bakuna, we still have to follow all the infection prevention and control measure until we can go back to our usual daily activity. So maraming salamat po at mag-ingat po kayong lahat.
Maraming salamat, Doc Nancy, Medical Director from RightMed Group. Ika nga ng RightMed, huwag mahihiyang magtanong. At kung may tanong pa po kayo, we sent the email address. It's info@unilab.com.ph for private companies, organizations who would like to explore or to give their expressions of interest for Covovax. Muli po, maraming salamat, Doc Nancy. Mabuhay po kayo.
Thank you.
Right. Now, let me to summarize the discussion. This is going to be very difficult, but I would like to share with everyone here on Zoom, on Facebook, YouTube, and on Twitter. Number one, thank you for listening to us for the last 2 hours plus. We'll wrap up in a few minutes, but I want to highlight specific points that all of us should take note of. I hope you can see my slide here about the national deployment and vaccination plan for COVID-19 vaccines. Can somebody say it? Okay, that's good. So, itong plano na ito na linabas po ng national government, this was released to the public about last week of January. Kung gusto nyo po ng kopya, I recommend you read it, especially kung bahagi po kayo ng planning o COVID response team ng inyong kumpanya, o kayo yung naatasan ng inyong pamilya na maintindihan kung ano nangyayari. Ito po yung short URL niya. It's bit.ly/NDVP. Ulitin ko bit.ly/NDVP. So yung sinabi kanina ni Doc Bev, yung magiging plano ng national government at yung pagpapatupad ng local government, nakapaloob po yan dito sa NDVP. 129 pages lang naman po siya, 117 pages. Kung tatanggalin mo yung table of contents, cover pages, okay lang. It's very light reading as you relax in the evening. But joking aside, I think this is how we arm ourselves and how we prepare ourselves. Kung meron tayong kakulangan sa kaalaman, merong mga pagkakataon na pwede nating maibsan yung kawalan natin ng impormasyon. And this is it. So NDVP, this is available for download for anyone, bit.ly/NDVP. Another thing we would like to share with you as PBSP, although we are not prioritizing or advocating for a particular vaccine, let me summarize the vaccines based on all publicly available data that we have as of today. So dito sa table na ito, mula kaliwa papuntang kanan, yung kaliwa nating column, ito yung siyam na brands ng vaccine na tingin namin bilang PBSP ay pinaka-promising. Ngayon sa buong mundo, lagpas hundreds ang available na vaccines from in development hanggang dun sa meron ng EUA, hanggang dun sa may actual approval na. So dito sa siyam na brand na ito, yung unang 7 brand, ito Pfizer, Moderna, AstraZeneca, Covovax, Sinovac or Sinovac, Gamaleya, J&J Janssen, these are all part of the government portfolio. Ibig sabihin, bahagi ito ng plano ng gobyerno na maisama dun sa 148 million doses na kanyang bibilhin sa tulong na rin ng lokal na pamahalaan at ng pribadong sektor. Itong column naman na ito, kung saang bansa siya galing, o sinong mga bansa ang kasama sa development ng bakuna na yon. Ito ang headquarters ng mga kumpanya na nakalista dito. Tapos yung platform, hindi po tayo doktor, pero ito yung iba't ibang klase ng mga platform kung saan po siya galing. For example, yung inactivated virus ng Sinovac, ito yung established na teknolohiya para sa bakuna. Inactivated virus, ibig sabihin, yung virus, wala na siyang epekto o bisa. Inactivated, so hindi na siya makakahawa. At yun ang centuries old na technology for vaccine. Yung pinakabago naman dito, yung tinatawag na messenger RNA. Ito yung nabanggit nito ni Doc Bev kanina. Gano'n siya kabago? mRNA are based on technologies from 2006 and 2009 Nobel laureates. Gano'n siya kabata, quote-unquote. They are less than 15 years old in terms of technology. At napakaganda. Actually, napakagaling how they applied this to vaccines. Tapos yung Covovax naman kanina, ito yung isa sa mga example ng protein subunit na tinatawag natin. O may adjuvant din, di ba, na tinatawag. And then meron kang tinatawag din na virus vector. Yung protein subunit, tulad ng nabanggit kanina ni Doc Nancy, ito yung hindi yung buong virus, yung spike lang ng coronavirus, kaya siya coronavirus, di ba? Kasi meron siyang parang crown o corona. At yung corona na yon may mga spike. So yun lamang ang naipapasok sa ating katawan para mag-trigger ng immune response. And then ito yung publicly available na efficacy rate base sa mga iba't ibang phase 3 clinical trials. Ang sasabihin ko pala tungkol dito, yung efficacy rate, hindi po yan apples to apples. Ibig sabihin, yung Pfizer, Moderna, o AstraZeneca, nung nag-clinical trials po sila, iba't ibang bansa ang dumaan na clinical trial nila at iba't ibang klase ng COVID-19. So for example, yung nabanggit kanina ni Doc Nancy, ang Covovax, nasama na dito yung South African variant. So iba, hindi siya the clinical trials are not created equal, nor do they address the same population or the same situation. So kahit na for example may mga mataas, may mga mababa, unfortunately for us, dahil mahirap siyang intindihin, kailangan pa rin nating basahin yung detalye. Kasi hindi po nakukuha ng isang numero lamang yung buong katotohanan. And then you have the storage requirements as defined. Makapansin ninyo, yung mga mRNA, kailangan yan ng mga ultra-low freezer or ultra-low temperature storage. Tapos yung virus vector naman, protein subunit, refrigerated temperature lang, 2 to 8 degrees Celsius, diba? And then, lahat ng mga vaccines na promising ay double dose, maliban sa J&J Janssen na single dose lamang. Tapos kung matatanong nyo, bakit namin sinama itong Clover GSK Dynamax at Bharat Biotech ng India? Ang Clover GSK Dynamax kasi, meron siyang phase 3 clinical trial sa Pilipinas. So ang Clover GSK Dynamax, o Clover na lang for short, kasama nito ang Bharat Biotech at ang J&J Janssen or Janssen at ang Sinovac na merong phase 3 clinical trial sa bansa. Ibig sabihin nun, meron tayong lokal na datos kung epektibo at ligtas ba ito para sa populasyon natin o sa subset ng populasyon natin. Mahalaga yun kasi yun ang isa sa mga yun ang actually pinaka-tinitingnan natin o tinitingnan ng ating vaccine expert panel at ng ating National Task Force sa vaccine. Ligtas ba siya at epektibo ba siya? Itong estimated cost naman, ito ay base sa datos na available sa publiko tungkol sa gastos ng bawat bakuna. So nagbabago rin, nag-iiba rin to. Tapos syempre hindi siya final habang hindi nagkakapirmahan ng supply agreement. So ito lamang yung at least available na datos na meron tayo. Dito naman, yung PHEUA, ibig sabihin, meron na bang emergency use authorization ang mga nabanggit na vaccine brands. Sa ngayon, meron na pong 3 vaccine brands or bakuna na nabigyan ng emergency use authorization ng ating FDA sa bansa. Ito ang Pfizer, ito ang AstraZeneca, at ang Covovax. Tapos merong pang 3 na brand na nag-apply na ng EUA. Ito yung Gamaleya ng Russia, ito yung J&J Janssen, at ang Bharat Biotech. Tapos yung nasa huling column natin, ito yung estimated na volume base sa mga naging report ni Secretary Galvez sa atin, sa private sector, sa publiko, sa Senado at sa Kongreso. So kung susumahin ninyo ito, actually sobra-sobra to. This is more than 148 million vaccines. Tapos meron pa tayong 44 million doses na manggagaling sa ating Covax facility. Again, Covax facility, COVAX, all capital letters. Ito po yung effort ng buong mundo na magdala ng libreng bakuna sa mga mahihirap at developing na bansa na tulad ng Pilipinas. Hanggang 20% po ng population ang kanyang i-cover. Kaya ang Pilipinas, hanggang 44 million doses po tayo, assuming 2 dose ang ating bakuna. Now, yung sasabihin lang namin para sa lahat no, sa nakikinig, ano yung maaari nating maging sagot o effort para makatulong nga kung susumahin natin lahat ng nabanggit ni Doc Bev, ni Doc Nancy, at yung mga naririnig natin mula sa gobyerno, ang target natin, dapat yung lahat ng adult Filipinos ay pumayag magpabakuna. At pag pumayag sila, dapat may bakuna na available. Pero yung 70 million na Pilipino na ito, nakakalat to sa lagpas 1,600 na mga lokal na pamahalaan, munisipyo at syudad. At ito yung mga syudad na hindi tulad ng mga syudad dito sa Metro Manila, di ba na? Ang Metro Manila may kakayahan, karamihan ng syudad dito o lahat ng syudad dito. Pero dun sa mga mas mahihirap na munisipyo, 3rd, 4th class, 5th class municipalities, paano kaya nila magagawa yung pagpapabakuna ng kanilang mga mamamayan? So I think the call to action for all of us is, can we come together as businesses, as NGOs, even as private citizens, to work hand in hand with our local government units to vaccinate 50 to 70 million Filipinos in 2021, if not up until 2022. We don't know yet how we will do this. Mahirap na undertaking ito. Pero I think kaya siya bayanihan sa bakuna. Nabanggit to ng aming Pangulo kanina, si Ray, na ito yung call to action natin. Di ba? Kung gusto nating makalagpas dito sa pandemic na ito at sa recession, ang bakuna ay isa sa mga pwede nating maging sagot. Hindi siya yung tanging sagot o tanging solusyon, pero isa siya sa mga pinakamahalagang sagot dito sa pinagdaraanan natin. At kung willing po kayo bilang organisasyon, NGO man, private, or bilang private individual, ito yung dalawang area kung saan tayo pwedeng makatulong. Yung una, tinatawag nilang 3Ms. Ito yung nakapaloob sa National Deployment and Vaccination Plan. 3Ms, master listing, microplanning, at mapping. Master listing, nasaan ba yung 70 milyong Pilipino na ito? Kailangan nating makuha yung pangalan, edad, mobile number, address, health condition, etc. etc. Lahat sila. Ito yung pinakamalaking database ng ating bansa kung matapos ito. So that's master listing. At lahat ito mangyayari sa lokal na pamahalaan. Hindi ito mangyayari sa national. Mangyayari ito bara-barangay, health center by health center, vaccination site by vaccination site. Yung microplanning at mapping naman, ngayon bawat mayor, kailangan niyang tignan ngayon yung kanyang sitwasyon sa kanyang bayan. Sasabihin niya, ilan ba yung mababakunahan sa bayan ko? Tapos, saan ko sila babakunahan? Sa health center ba siya? Sa public school? Sa covered court? Makikigamit ba ako ng pasilidad ng isang pribadong kumpanya? Yun ang microplanning at mapping. I-identify din niya sino-sino mula sa munisipyo ang gagawa ng aktual na pagbabakuna. So meron kang doktor, meron kang nurse, pero meron din yung magbabahay-bahay, sasabihin dun sa mga kababayan natin, uy, magpabakuna kayo. Tapos katulad natin ngayong umaga, di ba, ang dami nating tanong. Most likely, our fellow Filipinos will also have those questions about efficacy, about safety, about the essentialness of vaccination, especially for COVID-19. So, ito yung malaking effort na makumbinsi ang buong bansa na mahalaga at kailangang pagdaanan ang pagbabakuna para sa COVID-19. At yun yung pangalawa, ito yung tinatawag nating risk communication and community engagement. Paano natin, this is a fancy way of saying vaccine information, awareness, and education drive. Kailangan, kung meron tayong bakuna na darating at darating na sila sa madaling panahon, mahirap naman kung walang gustong magpabakuna, di ba? Lalo na dun sa ating mga priority groups, ang ating senior citizens at ating mga indigents o mga may hirap. So ito yung hamon sa ating lahat. Ito rin yung bagay na kailangan nating pagdaanan bilang isang bansa. Ito yung pinagdaraanan o pagdaraanan ng buong mundo sa buong 2021 at sa abot pa siguro to sa 2022. So kami po bilang Philippine Business for Social Progress, isa po kaming NGO, non-government organization, at narito kami katuwang hindi lamang ng pribadong sektor pero ng gobyerno at lalo na ang mga mahihirap at iba't ibang komunidad. Alam namin yung hikahos, yung hirap na pinagdaraanan nating mga Pilipino, lalo na yung mga Pilipino nating nasa laylayan. At ang bakuna, hindi ito ang tanging sagot, pero ito ang isa sa mga mahalagang sagot. So, bilang Executive Director ng inyong Philippine Business for Social Progress, narito kami katuwang ninyo sa paghahanap ng solusyon, sa pagdadala ng bakuna sa mas maraming mga bayan at mas marami nating komunidad. At maging katuwang namin ang lokal na pamahalaan, ang ibang NGO, ang iba pang organisasyon at kahit mga individual sa pagpapalawig ng COVID-19 vaccination program ng ating gobyerno. So muli po, maraming salamat kay Doc Bevho ng Kagawaran ng Kalusugan, kay Dr. Nancy Bermal ng Unilab at RightMed Group. Maraming salamat sa team namin dito sa Philippine Business for Social Progress. May mga ilan po na hindi natulog at hindi naligo para maihatid po sa inyo ang session na ito. This will not be the last session for PBSP and for #Bayanihan sa Bakuna. We will continue to do our best, including our partners, in giving you the right information at the right time so that we can execute our vaccination plans and our Build Back Better aspirations in the months and years to come. Maraming salamat. Ingat po tayong lahat at magandang araw sa atin.